professionalism that I'd spoken of earlier is evident. Once again in March and February, when we were struck with the dangerous cold, ice, and snow, they never wavered in their service to the city. They braved terrible conditions, sub-zero weather, ice, slick streets, slick paths to housing, and things of that sort. They braved these terrible conditions to make it to work, only to face the terrible conditions again that they had in performance of their duty. Once again, the slick streets, the slick paths, and things of that sort. Their unwavering service was to me a shining light during the worst winter weather that we've had in several years. And I'd like to formally thank every man and woman in this department, the Nashville Fire Department, for all that they did for this city, sometimes at great personal risk. I hope you'll forgive me if I begin my formal presentation by bragging some more about our folks and what they've been able to accomplish in the last year. Because of them, I'm proud to be able to say to the residents of Nashville today that we're operating fully within our budget for the current fiscal year. Better yet, we've been able to significantly expand and improve our services to this community without any additional cost to the taxpayers through creative deployment of our personnel and equipment. For example, we've added 3 new ambulance companies by reallocating 33 positions to staff 4 shifts. This will allow us to grow our total number of ambulances on our streets at all times to 25. These 25 ambulances will be in operation 24 hours a day, 365 days a year. When Mayor Dean's administration began, we had only 19 full-time ambulance companies. Since then, we have added 6 new ambulance companies. Expanding our emergency medical services is critical to our mission to this city as it grows and it ages. I think I spoke of this last year, but between 2010 and 2025, it's expected that the over 65 population in Nashville is going to increase by 64%. What does that require? You're getting older, you got to have more health problems. We need to really focus on this 80% of our run volume with EMS while at the same time making sure that we have adequate fire protection. Once again, as this population ages, these are our elders. They may be our grandparents, they may be our parents, it may be people like me or some of you guys here. But this is a critical mission to keep Nashville safe and provide the best services that a city as great as ours deserves. All of these folks that are running these medic units, in my opinion, they deserve well-equipped, well-staffed emergency medical services. We're working hard towards that goal while staying within our means. In addition to new ambulance companies this year, we've absorbed 35 new firefighter emergency medical technician positions that were originally funded by the federal SAFER grant. This brings the total firefighter positions our department has absorbed in the last 2 years to 67. All done with zero additional cost to the taxpayer. Over the last year, we've re-implemented our Fast Car program, a new initiative or semi-new initiative to cut down on miles and wear and tear of our fire equipment. Instead of sending a fire engine to all routine medical calls, we place 2-person teams in Chevy Tahoes at 5 of our busiest stations. In those stations, these fast car teams have cut on fire engine runs by more than 50% at those 5 stations, and has saved each of those heavy vehicles more than 4,300 miles of travel and wear and tear. In this particular instance, it's a win-win for everyone. It's a win for our equipment, it's a win for our personnel, but most importantly, it's a win for the taxpayers, the folks that pay our salaries. I want to stress how important that is to us. We're in the business of saving lives and saving property, but we also pride ourselves in finding ways to do it while saving taxpayer dollars. Going forward, I'll continue to make sure that all 3 of those goals remain a priority for this department. Our department does much more than just putting out fires and treating and transporting patients. In addition to top-notch fire, emergency, and medical services, we perform fire investigations. Our arson investigation unit, which is a bright and shining star in the Nashville Fire Department, continues to stand as what I maintain to be the best arson unit in the nation. In 2014, they investigated 309 fires, 56 of which turned out to have been intentionally set. Our arson investigation unit made 38 arrests. in 24 cases, and I'm happy to report that every arrest we made has resulted in a conviction. Our duties also include public education, which, for the uninitiated may be easily overlooked, but it plays a key role in our outreach to the community and providing services other than just people on heavy pieces of equipment. And we plan to expand on that greatly during the coming fiscal year. In February, we were proud to host a 32-hour car seat safety course for public officials across the state. Through it, we've improved our own expertise and plan to use that in the community at a number of events this year in partnership with the Safe Kids Coalition. We've also expanded our smoke detector campaigns. A smoke detector remains one of the most important tools in keeping your family safe. To that end, we've increased our efforts to distribute free smoke detectors to Nashville residents in need by partnering with community groups, churches, and the State Fire Marshal's Office. We have no doubts that our efforts in this particular area will save lives. And we cannot forget our fire inspectors, who have no trouble staying busy thanks to the unprecedented growth and development in this great city of ours. We have there's several major construction efforts going on. I think everybody's aware of that. In fact, we have two of those construction efforts going on within our own department. In February, we broke ground on Fire Station 19, which will replace an outdated station half a mile away and will sit across from the new Lentz Public Health Center. And just a few weeks ago, we kicked off construction on new Fire Station 20 in the Green Hills area. Both stations are expected to be completed this year and will improve response times and the level of service in both areas. Last year, through a $6.4 million capital appropriation through Mayor Dean's office and Finance Director Reebling, we were able to also purchase 7 new ambulances, which we now have put into service. That allows us to add those 3 new medic units. We're currently waiting for 3 more ambulances to arrive. We're expecting 13 brand new fire engines. Hopefully they'll begin relying 4 or 5, we'll start receiving them 4 or 5 at a time in the latter part of July. And we're in the process of putting 425 new self-contained breathing apparatus into service. Now, one thing this management team has done since we all came on board a couple of years ago is we've stressed firefighter safety. And I see an SCBA, a self-contained breathing apparatus. This is analogous to a soldier's gun as far as their safety is concerned. We're getting the best equipment out there, and with that good equipment, we're going to make it a safer job when these young men and women have to go into what I consider one of the most hazardous things in civilian life. That's an interior attack on a structure fire. I have no doubt that these new vehicles and pieces of equipment will improve the level of service that we provide our residents. We're proud to be able to serve the public safety needs of a city that has seen success and growth that's the envy of many cities throughout this nation, if not all. And we're proud to be good stewards of taxpayers' dollars by continuing to live within our means. But with that growth has come challenges, and we cannot afford to stand still when it comes to public safety. In 2014, we responded to nearly 100,000 emergency fire and EMS calls. That represents a 6% increase in fire calls and ambulance transport since 2012. All those increased calls add wear and tear on our heavy equipment, which is critical to our mission. As a result, our heavy fleet is quickly aging, leading to frequent and expensive repairs. Just to give you a sense of the state of our fleet, the average mileage on our fire engines is nearly 95,000 miles. The average life expectancy of a fire engine under the Office of Fleet Management Standards is 100,000 miles. The average mileage on our ambulances is about 145,000 miles, and life expectancy is 150,000 miles. Now, due to the attention and quality care provided by General Services and Fleet Management, we're certain that our vehicles will outlast those life expectancy standards. But it's critical for us to continue replacing our fleet as it ages to ensure that we can continue to fulfill our mission. Our firefighters deserve modern working equipment. Our paramedics deserve modern working equipment. And most of all, our residents deserve modern working equipment. We must ensure that our equipment, vehicles, and personnel are able to meet the growing needs of this growing city. Before closing, I believe it's important for me to state our mission for all to hear. Our mission, the mission of the Nashville Fire Department, is to provide high-quality fire, medical, and rescue emergency responses and community support services to the citizens and visitors within Nashville and Davidson County so they can work and reside in a community where an all-hazard response minimizes harm to life, property, and environment. Once again, this is a mission we're proud to fulfill every day as we respond to these different emergencies. At the same time, we have to be wise in spending our tax dollars, and we're trying to keep our thumb on that as well. And we believe with your continued support, we can continue to exceed those expectations. Thank all of you for your time.
Thank you, Chief. I don't know if I asked you the question, but can you live within the mayor's proposed budget?
Yes, we can.
Thank you. I'll open the floor up to council members. Councilman Pardue, first in line.
I appreciate it. Chief, good to see you, by the way.
Good to see you, Councilman.
Looking at your paperwork here, it shows that you've got 1,206 authorized positions and only 1,145 are filled. So, not being the sharpest knife in the drawer, that to me shows 61 people short. Is that true?
It would make one scratch their head, I'm sure. I'm going to let Leanne answer that. She can give you the explicit reason as to why that exists.
Thank you.
Yes, sir, you're correct that we have approximately 60 vacancies today. We have 35 of those vacancies that are unfunded. It's where we absorbed the 35 employees from the SAFER grant this year, and we no longer have any funding for that.
Did you ask for funding for that in this budget?
We did not include that in this year's budget, as we were encouraged not to. We were encouraged to absorb these positions into our budget.
By who?
That is
and don't be scared. Come on.
That is advice we were given when the department chose to accept the grant several years ago.
Well, I got to say that whoever advised you of that and put this city's fire department 61 people short is an idiot. And I don't care if he's a janitor or if he works downstairs. If we run in 61 positions short because somebody advised you to, that's wrong completely. I don't want to start cussing, but
please don't.
Go. Thank you, Your Majesty. Going back to the fast cars, Chief.
Yes, sir.
You've got 5 stations running those, correct?
Right. Yes, sir.
Can you or any of your staff that's here answer the question why in the last couple of weeks we've been running a couple short?
Well, many of these fast cars have been staffed with overtime, and the overtime budget is getting a little lean. After July 1st, we're going to do we're going to develop a better management plan for overall overtime usage in the department, and we hope to have that alleviated, and it won't be an issue next year at this time.
Well, personally, I don't think that burden should fall on either one of y'all. If we fill the 61 positions, you should have personnel to run the cars, correct?
Oh, yes, sir.
Okay. Well, I guess I'm done, buddy.
All right.
Thank you.
Thank you. Council Lady Langster.
Thank you, Mr. Chair. Good afternoon, Chief. And let me ask you a question about the budget. How much would 60, maybe you wouldn't know, how much would 61 positions cost you?
I'm going to Leanne's the number wizard. She'll get you real close, if not the exact number.
Okay, and while she's looking that up, the engine company 11 and the engine company 19, you know, there are 2 in my district.
Yes, ma'am.
I call them chase cars. I don't know what the proper name for. Has that car been delivered?
That's the fast car. We'd implemented them at 11s and 19s. As Councilman Pardue pointed out, we pulled them out in the last couple of weeks due to budget constraints. But starting July 1, Once again, part of this is our fault in the management of the overtime budget. We're going to take care of that, and it's not going to happen again. Got my promise.
So you've already looked in your budget and found that you can do it after July 1?
Yes, ma'am.
Is her name Leanne?
Yes, ma'am.
Leanne, did you get just a rough estimate?
The 61 positions we have are not all at the same rank. Perhaps you're more curious about the 35 positions that we absorbed out of the SAFER grant. Salary and fringe, that would be approximately $2.4 million.
$2.4 million?
Yes, ma'am.
To make this city a little extra safer. I'm hesitating because I need to know, Attorney Cooper, can that amount go in on a wish list?
Yes, ma'am, that amount could be put on the wish list. Finding $2.5 million would be another issue, but it could be added to the wish list.
Okay. Mr. Pridemore, I would like to add $2.1 million for personnel in the fire department.
2.4?
2.4, I said 2.1, but 2.4. I'd like to add that to the wish list because this city does not need to run short of firefighters or police officers. They're two very critical departments, and if we can find a way, I would really appreciate seeing that funded for personnel. Chief, when's the last time you've had a class graduate from the fire academy?
I guess I may be off on this. I'm going to say about 20 months was the last time we graduated class, 20 months ago.
And do you have a list prepared, ready to go?
As a matter of fact, we don't. We were a little unsure when we were going to be able to have the numbers that we could actually justify the fiscal cost of a class. And right now, we've got, the city has on contract a vendor that we'll be getting with hopefully by mid to late summer and start putting together the testing requirements, the tests, setting up times where we can, do our search, our, email search or advertising on social media or whatever. And then hopefully by, I would say, no later than the end of the second quarter of next FY, we should have a list established. We could have done this 2 years ago, but usually those lists only last 3 years. And to me, it just seemed pointless spending that money when you didn't know how many people, if any, you were going to be able to hire.
You're exactly right. What about EMTs? Are we close to being stable with that position?
I think we're very stable with the number of units that we have in service. I think the numbers, if they increased, incrementally throughout the years, we're going to need to add more medic units as well.
And with 13 new ambulance, are we going to need personnel to?
Well, it's 13 new fire engines. They're going to be replacing existing pieces of equipment that have a lot of wear and tear on them and a lot of age. And on the short term, that's actually going to help us as far as our shop maintenance and everything is concerned. We'll be keeping, the best of the ones that are in reserve now. Maybe some we're taking out of service will be fully fit to be operating a reserve category. So that'll help us in the short term. But the key to all of this, and I like to stress incremental changes in the way that we purchase equipment.
Has your budget allowed you to do any promotions during this 20-month timeout?
No, ma'am.
Okay, thank you.
Yeah, now, let me say this about the promotions. Part of the reason why we haven't done any promotions, and I'm going to take full responsibility for this, I was trying to get a couple of different classes inserted in there. It doesn't look like they're going to be inserted, so we're in preparation now to promote some folks, and actually we'll be doing promotions before we start working on a new hire list.
So you have the new hire list is there, and people who have applied for a promotion is there. Are you waiting for us the budget to pass to do this?
Not necessarily that. All of our lists are very old when it comes to like captain's promotions and engineers promotions. And once again, our civil service requirements, pretty much require us to can a list after a certain duration of time and start it all over. But once again, we have been talking with CHS or CSH, the new vendor for training protocols and tests and things like that. We're in constant communication with them. We're going to start working on that as soon as we can.
Okay. And again, thank you for Engine Company 19 going up. I really, really appreciate it. And the 21st District does too.
Well, Engine 19 was long overdue.
Thank you.
Chief, in looking at and Councilor Langston, looking at my notes that I'm supposed to mention each day, if an item is placed on the wish list, the department head, as soon as possible, if you could send some supporting documentation to Elise as to what the wish list was. And I know you didn't ask for it, that Council Lady Langster did, so maybe you can get with Council Lady Langster and come up with whatever the supporting document, or Councilman Pardue, whatever. Okay. Councilman Glover.
Thank you, Mr. Chair. Chief, let me ask you, and you may know the answer to this. You said your call volume increased by about 6%.
Yes, sir.
Okay, but yet your fees collected, if you look at charges, commissions, and fees, last year versus what is projected for next year, is down by almost 12%. Do you know why you're having such a decline in fees? I assume you're running more runs, so.
Well, Ms. Hager can answer that more fully than I can. There's a lot of different factors, I will tell you that, but I'm going to turn this over to Leanne to explain.
Councilman, will you mention one more time exactly which line item you're looking at?
I'm looking on page F32-1.
Okay.
And if I look under revenue and transfers, charges, commissions, and fees, 13-14 was 9.6 million, then 9.3 million, and projected for 2015-16 is almost 2 million. So almost $1 million drop in fees and commissions, and so.
And if you'll flip over to F32.5,
Okay.
you'll see that in total, our revenue for fiscal year 16 is actually projected to be higher than the revenue we had in FY15. And it's where we're realigning where the revenue comes in. With our EMS revenue, it's difficult to predict the types of payers we will see each year. When we pick you up as a patient, we don't know if you're going to be a commercial insurance, Medicare, or private pay. And we tried to realign the revenue projections based upon the historical trends we were seeing coming in.
Okay, and so but you're looking at the actuals, obviously. So attempting to be extremely conservative.
Correct.
Okay.
But
The reason I'm asking is because if a $2.4 million request was just made, if there may be a possibility of money being there, that's one of the areas that I'm exploring.
And our revenue in fiscal year 15 was budgeted at 13.1 million, and for fiscal year 16, we are budgeting 13.4 in the GSD.
Okay, but if you look, and let's just make sure I'm following you when we're talking, you had budgeted for 2014 13.5, and actual was a little over 15 million on the same F32.5.
Correct.
Okay, and so do you know what do you have an estimate of where you're going to land this year?
I think we will be right on with our budget.
Okay.
As you well know, with the changes in healthcare, medical payments fluctuate widely.
Well, we've heard from the court system, and their fees and things are down because of indigent care.
Yes.
And so I guess I'm trying to find out, is that what's happening here? When you see a 6% increase in runs and you see a 12% decrease in potential fees and revenues,
it's a mix of the change in our payers, depends on how many we're getting commercial insurance versus Medicare and whatnot. We're also under a Medicare prepayment audit, which is is just a standard review that an entity does. So before any of our claims go through and Medicare pays us, there's an immediate audit done of those claims, and it delays the payment significantly.
Okay, and what about Medicaid, TennCare? Is there agreements there where you are able to receive funds for an ambulance run, for lack of a better word, or do we just have to write that off?
We do receive payments for transports where patients are covered by TennCare or Medicaid.
Okay. All right, thank you, Mr. Chair.
Thank you. Council Lady Weiner?
Thank you, Chair. Thank you, Chief. I appreciate you being here, and Leanne, you as well. I want to go back to the SAFER grant just a second and just ask a couple more questions, because I'm looking to see if there are any funds to offset that $2.4 million to cover those 35 employees. What's the rate of retirement per year? About how many employees do we lose from retirement per year?
I don't have the specific numbers with me. I can get you an exact number. I will say this, our turnover rate is extremely low.
Well, it would help to have that information, because I'm also looking to see where you might have cut the $2.4 million, since you had to absorb that into your budget. Where else did you cut in order to be able to sustain keeping those 35 employees?
The buyout that occurred 2 years ago, that we had to start planning then. We've absorbed 67 positions, as Chief White mentioned, and when the buyout occurred, the first 67 positions that came through, we had to hold for the SAFER grant.
Got it.
Or for both SAFER grants, excuse me.
Okay. So I guess my next question goes to not operational, but more budgetary line items for the firefighters themselves in terms of equipment and clothing and those kind of things. Do they get an allowance for clothing? Does that allowance change per year with the costs going up? Do they get their clothing purchased for them? How does that work?
Yes, ma'am, we do offer a clothing allowance to the staff. Chief White has made it a priority to focus on the field personnel so that they receive the first allotment and the higher rate. We use a tiered approach. Funds are limited, so we try to focus on those who are in the field, and for lack of a better terms, those that are involved in smoke or
blood, or any type of thing that'll get your clothing dirty on an emergency call.
Okay. And let's see if I had any other questions. Oh, are you negotiating reimbursement rates with your third-party payers annually for ambulance runs and things like that?
We have a contract with a billing company that handles all of our EMS billing for us. And that is a contract that was recently renegotiated this year. We do not personally get involved with any insurance companies.
Do we know if that company is renegotiating annually those reimbursement rates?
I can get back with you on that.
Yeah, because you can, and sometimes that's helpful. I think that's all I've got. Thank you.
Thank you.
Councilman Claiborne?
Did I choke you up?
Not yet. Not yet.
I promise to be good. Thank you, Chief, for being here. I have 2 or 3 questions. One is just for information. When I have an opportunity to talk with firefighters, if the conversation goes on very long, inevitably they say, why can't we have our own shop back? Why can't we take care of our own equipment? So I was noticing in your internal service fees that you have in excess of $1.5 million for fleet. I assume that's, repair the vehicles, keeping them running and so on. So has the department done any study to see what it would cost for you to have your own fleet service back rather than running through general service garage?
Well, No, sir, and I guess I will take full responsibility for that. I think under the budget constraints that all of us, all departments have been dealing with in the last few years, if we're talking about 1.5 million, that would not touch what it would take for us to establish our own shop.
Okay.
You would have to amortize probably 5 or 6 million per year for, ad infinitum.
Okay. Okay, that's what I'm looking for.
And let me tell you, I know when you talk to these firefighters, I used to be one, by the way, but, you look back at the past and everything looked real rosy. I grew up in a house that didn't have air conditioning and very little heat. I had a happy childhood. I look back on it and I'm happy. But I want to go back to a house that didn't have any heat or air conditioning. No, sir.
Okay. Well, okay, at least I've got something other than my pat answer. I don't know.
Okay. Well, we try not to do pat answers.
Second question, I have two stations in my district, 27 and 22. Both of those folks do a great job for people in District 15. And I have been lobbying for years for Station 22 to get a new engine. Now, I know you're not the one that makes those assignments, but if anybody out there is listening that has that responsibility, it's time for 22 to get a new engine and not a hand-me-down.
I will email you the status of whether 22s is going to get a new engine or not early next morning.
All right, thank you.
Yes, sir.
Talking about personnel, I know it has been the policy in the past to have 3 men on a truck when it goes out. That's not always, that doesn't always happen. So how are we in terms of having 3-man crews on?
Well, Councilman, I think you've gotten some bad information there. We will not send out a heavy piece of equipment without 3 people on it. Now, our medic units, our ambulances, they'll run with 2 people. But they're still, even operating under the constraints everybody operates with money and everything, there's still a couple of engine companies that are so far outlined, we have to keep 4 people on them. And that's another thing that's real good about these fast car programs. If we can keep them staffed, that's 2 additional people showing up on the fire ground, which helps us to commit to the federal regulation requiring 2 inside and 2 outside.
Okay, so you're saying that presently there are at a minimum of 3 people on a piece of equipment when it leaves the station for a call?
Yes, sir. In all sincerity, there better be.
Okay. And then just a comment as a follow-up to the conversation about the 30-something different new positions that are being left vacant. Mr. Chair, as y'all go through the finishing up and looking at the wish list and so on, perhaps if that whole amount's can't be found or is available, maybe it could be looked at as a phase thing with half this year, half next year, or a third this year, a third next year, and a third in 3 years. Certainly some is better than none, and if you can't have it all, then to get a few and work toward the total number might be another option for that. Thank you.
Thank you, and that Elise is noting that on the wish list. Councilman Tigard.
Thank you, Chief, and I feel like Councilman Pardue is not the sharpest knife in the drawer. Tell me if a fast car is a more efficient method of answering calls, why it's not done as standard procedure and why it falls under an overtime category as opposed to a better way of doing business.
Well, there's a couple of different ways of doing these fast cars. We could have a 3-person crew and assign a fast car to that 3-person crew. And if they go to a medic call, they pull 2 people off that engine and make the medic call in that fast car, which essentially takes your engine out of service for fire protection. There are several constraints that we really operate under relative to making sure we have adequate staffing on the scene. And I'm going to tell you right now, ever since I've been on, we've been one of the worst departments about doing that. And if we have to use some overtime to make sure we're going to have enough people so that we can have 2 people on the outside waiting to rescue the 2 on the end, that's the only way I know to do it, sir.
So the bottom line, it's simply a matter of personnel. It's not a matter of efficiency and whatnot.
Yes, sir, it's always a matter of personnel money, you know that.
Thank you.
Councilman Hager?
Thank you, Chief, for coming today. Appreciate it. I was going to ask you about the ambulances you have now. What is the mileage that you get out of those particular ambulances that you have now?
We've got a set mileage of 150,000 miles. Now, that's established by Fleet in conjunction with the department several years ago. And when we first started doing that, we weren't making the transports we were. And, you know, you could maybe get 10 years out of an ambulance. Now, we're seeing about 7 or 8 years out of an ambulance before it rolls over that. And fire engines are a lot different than your typical diesel truck on the street. They've got pumps and things like that kind of complicate the mechanism involved, just as the ambulances do. You wouldn't believe what it takes just in the summertime to make sure that the air conditioners in the back of those units meet the state standards. They've actually got a state standard that tells you how much lower below the ambient temperature it needs to be in the back of that ambulance, and of course that's for the safety of the patient. So there's a lot of mechanisms in there other than just the drivetrain.
Okay. But as I understand, these are gas burners you're talking about right now, the 150,000 miles?
They're diesel burners.
All right. These new ones you've got that are coming in, the 13 new ones, are they not able to go 250,000 miles under the standards?
One would think. I mean, I'm well familiar with diesel drivetrains, diesel engines, gasoline engines, and all that. And ever since I've come on this job, I've scratched my head that we can't get more miles out of a diesel drivetrain than what we get out of them. But there's several issues at stake. First of all, these things are going from a totally cold off position to, you know, running at least 10, in many cases, 10 miles over the regulated speed limit. So it's not like they're out here on the road and, you know, you can expect to get 2 or 3 million miles because they're just doing that steady pace up and down the highways.
What's the warranty period on these new ambulances coming in?
The warranty period on the new ambulances, I'm going to have to get back with you. Different components of it have different warranties is what I'm getting at. The body is going to have a different warranty from the drivetrain. Now, the one thing that's complicated the use of or the procurement of our ambulances in recent years is we used to buy a frame and have that frame, an ambulance built around it that had a 200,000 plus mile life expectancy. And then all of a sudden that was dropped to about 100,000. So we had to go out here and start finding some more different companies that offered us that. So that's a big part of it right there. You know, a lot of times if we could get us a limitless mileage on a frame, it's possible to rebox them. You know, go ahead and work on the engine, do whatever you need to do there, just put a brand new box on top of it. That's when you can really start saving money on these pieces of equipment.
Yeah. Just let me know what that warranty is.
I will.
The other question I had, at one time I know one of the councilmen brought up the maintenance department. It was my understanding at one time that was it not true that police and the fire department maintenance crew worked on the emergency vehicles only?
Well, I can't speak for PD, but I know I came on in 1978, and we had our shop until, golly, it was probably the second or third year of Mayor Purcell's administration, and that's when the fleet concept and, consolidation actually came into being. But no, we did all of our own repairs and a lot of stuff. Okay. Sometimes our shop would actually build a fire engine.
Yeah. Would there be a study, could that be done as to put all these emergency vehicles into one maintenance department since they are a priority out of the general services?
Well, I would be glad to entertain these conversations with general services, which fleet maintenance falls under. But it's going to have to be a two-sided conversation on that. They've got some very good ideas, I'll tell you. And Union President, myself, Mark Young, we meet with Stacy Wall, who's over a heavy fleet. We've started doing this recently once a month, and hopefully what we're going to be doing is looking at maybe some failures we had the previous month. Why did this happen? Was it my mistake? Was it your mistake? So we're trying to work this stuff out.
Okay. And as far as adding EMTs to a fire station, what is the criteria for that? Within a certain mileage of another fire station, or? Who sets that criteria?
I don't really,
For the ambulance services.
right.
I mean, like Old Hickory does not have ambulance service, but Hermitage has.
Well, we provide emergency ambulance service for all of Davidson County.
Right.
Right.
But some fire stations have an ambulance and some of them don't.
Oh, yes, sir. Some do and some don't.
And what's the criteria for that?
Well, we actually try to look at the run volume at those particular stations. Also, we've got, from time to time, 2 ambulances running out of Station 9, which is downtown. Station 2 will have 1 or 2, depending on the time frame and everything. And they're real close to the inner loop. And also, the stations are pretty close to the hospital. So generally, we can do a reasonably quick transport, get them back in service at the station, so they can replenish supplies and things like that.
Okay. And is Old Hickory going to get a new fire engine?
Old Hickory?
Yes,
I can
sir.
email you that. I'm going to tell you how we do this. And really, and it's the only fair way I know to. I know all you guys want your stations to have new fire engines. I do too. But we look at the miles, the wear and tear on the engines that we're going to replace. Also, one thing I like to look at, sometimes you might have one that's got 125,000 miles, even though the cutoff is 100,000 miles, but you've never had a problem with it. Well, to me, it just makes good sense. Go ahead and keep that one. Let's just see how long it'll last.
Right.
So it's a little bit of engineering, it's a little bit of accounting, and a little bit of magic involved.
All right. Thank you, Chief.
Yes, sir.
Councilman Glover.
Thank you, Mr. Chair. You may know the answer to this, you may not. One of the problems you're having right now, it sounds like, is because overtime funds are drying up. You're not able to staff the fast cars. Can you tell me how much you have allotted for overtime, and what is, how is it used for the fast car? What exactly is it used for, and can you come back and reallocate if you filled some of these positions? Because I don't know what you pay overtime. I don't know if it's time and a half.
Yes, sir, it's time and a half based on the base salary of the individual.
Okay, so we're missing 50% of an opportunity, and I'm wondering if it could be budgeted a little bit differently.
And another thing about this time of year, though, I mean, post-Memorial Day, schools are out of session, people are wanting to take vacations and things like that, so we'll actually pay more in overtime just to keep minimum staffing going, probably May through, I would say, the latter part of October, than we do the rest of the year.
Okay.
So it's seasonal is what I'm saying.
Okay.
And that's the reason why you have to watch it.
Right. Well, I mean, I know you can't avoid overtime. I'm just wondering if there's a way to reallocate. And so, anyway, thank you, Mr. Chair.
Council Lady Johnson.
Thank you, Chair. Thank you, Chief, for the incredible leadership you provide, and all of your dedicated staff throughout the fire department. You're very much appreciated. I know my constituents they always appreciate the fact that we have a brand new fire hall not that far away. And I had promised a constituent who lives over on Cedar Cliff that I would ask you this question today. There was a incident that happened where there was a life and death situation, and the ambulance was not available for our area. I know we have 33 and 35 because there's one over off of Hobson Pike. I think that's 35. And there's only one ambulance, and that ambulance was pulled away somewhere else. And so the response time was really, really slow, and it caused a significant problem with this particular situation. And he asked, one, is there any efforts to put an additional ambulance at 35? Is it at 35 or is it at 33?
I think we've got units at both of those.
At both. Okay. Is there any reason why both of those would have been pulled away?
There's a lot of factors go into it. Short answer is probably just a large call volume day.
Okay.
And, sometimes you'll pull a unit from one area of town to another area of town that's got a wide expanse of zero coverage due to the units being tied up, and it does result in longer response times.
Okay, because
If you'll get me the address and the date this occurred.
Okay, I can do that.
I can give you a more definitive answer. I'm just calling stuff off the cuff here, and I don't need to be doing that.
Okay, because he was under the understanding that it was only one of the stations that had an ambulance, and so I was to ask you today, to look at and see if there's a possibility that both stations can have an ambulance at both stations.
I think we've got that in place already.
Okay, thank you.
Thank you. Thank you.
Councilman Tenpenny.
Thank you, Chair. Hey, Chief, how you doing this afternoon?
Pretty good, Councilman.
Chief,
How you doing?
I'm doing pretty good. I just have one answer. As far as money goes, how much did you turn back in last year?
What was the total? Approximately, 3 million, something like that? Total.
About 3 million?
Yes, sir.
And how much do you plan on turning back in this year?
You want to answer that?
We've committed to returning approximately $3 million this year because we met with the finance director and the budget office earlier this year, and they have graciously agreed to let us use salary savings to purchase new safety equipment for the firefighters and
Yes.
medics. So the money that we're turning back in is just in exchange to spend it a different way and buy the equipment.
Okay, thank you. That was all I had to ask. Thank you very much.
All right.
Good answer. Very good answer.
Chief, seeing no other council members in the queue, want to thank you for being here, and thank you all for your presentation, and we certainly appreciate all that you do.
And once again, I want to thank all you guys.
Yes, that's correct.
Since we've had several more council members come in since